Thank you for the invitation. The aim of the study was to evaluate the clinical usefulness of suPAR in monitoring the disease course and prognosis patient treated in the intensive care unit. Methods: a comparative study of plasma suPAR concentration, serum CRP, PCT, WBC count, and APACH-2 score were performed. suPAR test was not used to conduct the therapy. For today's presentation, I have prepared 6 medical cases. Case number 1, male, 79 years old, patient hospitalized in ICU due to respiratory failure, hypoglycemia, second type diabetes, insulin treatment, with symptoms of acute abdomen. Patient died at day 14. APACH-2 scale, 22 to 23 score, indicated a severe condition, low PCT, concentration suggested no systemic infection. CRP concentration increased to the 4th day of hospitalization and dropped at to 11 days and slightly increased to day 14. WBC count confirmed systemic inflammation. The suPAR has grown steadily since the value about 7 to value close to 19 microgram per liter on the eve on his death. Conclusion: patient died. A systematic large increase in suPAR concentration in next few days portends unfavorable course of disease. Case number 2, female, 74 years old, patient admitted to the ICU because of cerebral hemorrhagic stroke and respiratory failure. PCT concentration and WBC count were normal. Yes. CRP concentration increased steadily to 9 day of hospitalization, and then clearly decreased to value of about 40 milligram per liter. suPAR concentration was ranging from about 4 to 5. It does not exceed a value of 5 microgram per liter. Conclusion: the patient survived. The Virogates company describes this level of suPAR for women aged over 70 as no risk. Case number 3, male, 52 years old, patient hospitalized in the ICU after cardiac arrest and successful resuscitation. Very interesting is this point. APACH-2 scale on admission 24 score. The PCT has increased and decreased after antibiotic therapy. The concentration of suPAR was high from the beginning of hospitalization and slowly increased to 5 days, and then a little dropped. Patient survived. Conclusion: the systemic increase of suPAR level, together with inflammation parameters, from the beginning of the therapy to 4th day, suggested unfavorable prognosis. However, the level decreased at 5th day. The patient is alive. Case number 4. Male patient found in the apartment laying on the floor for several hours. Patient hospitalized in ICU and conscious. In the third day, the cardiac and breathing arrest occurred. Resuscitation was not undertaken because of the condition of the patient and unfavorable prognosis. Patient died. Patient hospitalized in ICU in a severe condition, APACH 2 23 score. The patient died after 2 days. Levels on CRP, WBC count, and and PCT is the first day was higher than in the second day. In contrast, the concentration of suPAR in the second day was significantly higher. Conclusion: patient died. From the beginning of hospitalization, increasing concentration of suPAR pointed to high risk of death. Case number 5. Patient hospitalized in ICU because of symptoms associated with decompensated diabetes, persistent vomiting in the alcoholic hours. On admission, in severe condition with considerable metabolic disturbances. Conclusion: the patient is alive. The high concentration of suPAR from the beginning of hospitalization was a bad prognosis. Our study is in progress. Case number 6. Patient admitted to ICU unconscious due to cardiac arrest after a double resuscitation. APACH 2 on admission was very low, only 14. Procalcitonin was normal. CRP, WBC count, and suPAR levels increased before death in the third day. It's parallel. The patient died. Conclusion: the concentration of suPAR in the first 2 days did not indicate danger. High growth of suPAR was visible in the third day. Patient died. Conclusion: the dynamic of concentration of suPAR, both in patient who survived and died, was different than the other parameters, inflammation parameters. Dynamic of suPAR level is characterized by increased concentration in the event of deterioration and death of the patient and decreased concentrations for effective therapy. The dependency is not visible to other tested parameters. Preliminary results indicate that the evaluation of plasma levels seems to be a useful prognostic parameter of clinical course of disease in a patient treated in intensive care unit. Thank you for your attention.